The Alaska Health Fair is a nonprofit organization that has been helping people with affordable blood tests since 1980. These blood tests are often more affordable than getting them done through insurance and are just as reliable. You can make appointments through their website, alaskahealthfair.org, but they also accept walk-ins. Just remember to get the best results possible to fast for at least 12 hours. This means no food and only water. Most types of screenings will cost under $50, which includes things like glucose and cholesterol. There are additional tests for a fee. Most can be found on their website. Their next fair will be on March 11th, 2023 in Anchorage at St. John Methodist Church on O'Malley Road. I recently attended their most recent health fair, and this is what happened.
Yes, welcome to the Alaska Health Fair here at the First Christian Church of Anchorage. We're having all sorts of blood draws today and blood pressure tests and eye and hearing tests that you want to participate in. This is our outreach to the Rogers Park community, and we do this in honor of Jerry Ivy, who was in the picture, and she loved yellow roses. She was a part of our congregation a long time ago, and she was the one that was trying to keep us all healthy and happy and loving. She was a nurse, and her husband was a doctor here in Anchorage, and we do this in honor of her and what she taught us to do, and to reach out into the community and let them know that we are here for them. She just had a loving heart, and she wanted to give back to the community as well as our church. So today was in honor of her with the health fair.
Hi, my name is Mimi, and I'm a volunteer here at the Alaska Health Fair. I've been doing this for at least 15 years. In this particular area, we're taking blood pressures. All of the people taking blood pressures are nurses. A lot of people think because they're fasting, they can't take their medications. Wrong. They have to take their medications with a lot of water. That also helps the phlebotomists. We also recommend that they have blood pressure cuffs at home, because a blood pressure at home is going to be a lot more accurate than a blood pressure here. If they're concerned whether their blood pressure cuff is accurate or not, I recommend that they take it to their primary. We have had a couple of people where the blood pressures are extremely high. I had a young fella in his 20s where the diastolic, which is the lower number, was never below 120. That should be where the high number is. I wouldn't let him go to work. He was a teacher at a high school, had him go straight to a clinic. We had one fella show up one time and he said, "Those ladies scared me. I went straight to the doctor and he put me on blood pressure medicines, and I had to come back and say thank you."
Hi, my name is Rick McAvoy, and I'm doing visual acuity testing here today, helping people determine if they need glasses or not, and if they do have glasses, how well the glasses are working for them.
My name's Jennifer, and I'm here volunteering for the health fair doing phlebotomy. Basically, we're drawing blood. Most of the tests that we are drawing for are screening tests, like your cholesterol, your A1C, which is a good indicator for diabetes. Also, we can test for men your PSA, which is prostate. Vitamin D, another good one here that we test for in Anchorage since we don't have a lot of sun. And typically it's at least 12 hours. And the test that we ask for you to fast for is your cholesterol. So it's more of an accurate reading of your lipids, HDLs, LDLs. If you eat, say, a fatty breakfast, it will skew the results. So it's better to have 12 hours of fasting so we get an accurate reading of what your cholesterol levels are.
Well, we're just remarking how wonderful this health fair is today. We're having a great time.
My name is Dave Schroyer. I'm volunteering at the health fair. What I do is they call blood test registration. We check out the forms to make sure they're accurate and question people about whether or not they've been fasting or diabetic, and answer some simple questions about what test they might want to get. And then we take their money and send them on to get their blood pressure taken and get their blood drawn. There's a cost for the blood tests, and Alaska Health Fair is a nonprofit. They make a minimal amount off the tests, is my understanding. So the health fair itself is funded basically by grants and donations. And pretty much everybody here working at the fair is a volunteer. A lot of retired nurses who want to keep their credentials, and other people who just want to help out the community by helping out with the health fair. Health fair provides blood tests that are just a fraction of what they cost at a professional medical clinic. They could get a hold of the Alaska Health Fair office here in Anchorage, or if they're coming to health fair, there's a box on the form where you can make a donation of any size. Any amount's appreciated.